The study impact of the economic crisis on the working conditions and quality of life of persons with disabilities in Spain between 2013 and 2014. The data showed that persons with disabilities experience a significant decrease and disadvantage in the rate of activity, employment, and wages compared to the population without disabilities. Similarly, experts also emphasize the importance of empowering persons with disabilities in the labor market and reducing the dependence on subsidies. In general, the economic crisis had a disproportionate impact on persons with disabilities.
Poor working conditions and lack of social support can have a negative impact on job satisfaction and well-being of people with disabilities. In addition, hypotheses suggest that job satisfaction, intention to leave the organization, perceived stress, level of burnout, and life satisfaction may be negatively affected in 2014 compared to 2013 due to the economic crisis and deteriorating work conditions. These hypotheses are based on evidence that poor working conditions and discriminations can lead to the chronic stress and occupational burnout in workers with disabilities.
31 workers physical, motor, and mental disabilities from a company with an ordinary labor regime without protection participated. They were contacted through the Foundation. They used different instruments to measures that were able to be studied, like which parametric tests verify the assumptions of normality and homogeneity. Regarding normality, the Shapiro-Willis test was taken because the sample was less than 50 people.
The result of the lodging students were of the recent opposition to working with disability might precautions working conditions. Finding of the causing factory of the greatest effect to that certain mental health is the personal of imbalance showed with the impact of deteriorating working conditional the reflected between the years 2013 and the 2014.
During times of crisis, disabled workers face worsening work opportunities and conditions. Factors like perceived imbalance between efforts and rewards, stress, burnout, low wages, and lack of support can contribute to mental health disorders. The style limitations include a small sample size, the need to compare with non-disabled college, and a longer follow-up period.
Extensive research has shown that in times of economic crisis and recession, there is not only a deterioration of mental health, but also a deterioration of the working condition of the population. The information obtained led us to hypothesize that there could be a worsening of the subjective perception of people with disabilities in relation to the workplace as a consequence of the recession. The results show a significant and moderate decrease in perceived organizational support, perceived social support from supervisors and coworkers, and life satisfaction of workers with disabilities.